Hello, everybody, and thank you for watching. This month's interview is with my dear friend, Madeleine Kerkhof. I hope I said that right, the last name. Yes. Okay. She's a wonderful woman. If you don't know her yet, she's all over the place. She's the master you want to go to if you want to know anything about palliative care and aromatherapy and CO2 extracts and much more. So let me tell you a little bit about her, and I'm sure I'm gonna not mention a lot of things, so you can interrupt me and add. She is definitely the founder of KITSO, which is short for Knowledge Institute of Complementary Care, and it's a wonderful, wonderful project. So do you want to start telling us a little bit about what that is?
Sure. Hello, everyone. I'm so happy to be with my good friend Melanie and Dropsmith. And so, yes, KIKOZO is the Knowledge Institute for Integrative and Complementary Care. And I mainly teach nurses and other healthcare professionals how to incorporate aromatherapy and also other techniques into the mainstream healthcare system. So we don't really train people to become aromatherapists, but we train the nurse and the one that is on the bedside to integrate aromatherapy into their care. And we also train aromatherapists in continuing education in palliative care and elderly care, dementia care, oncology. So everything to do with very fragile patients. And I use conventional essential oils, and I'm an expert in CO2 extract. So, but I do integrate all of them together to get the best kind of product for patients. So that's what I do.
Excellent. So with these interviews, what I wanted to do is introduce people whose books we quoted, and Madeleine wrote 3 books so far that I know of, and this is one of them that we quoted, and thank you so much for allowing us to do so. And yes, please show the rest. This one we're in the process of entering when we are going to have CO2 extracts as well. So very, very good book. I recommend to read it. I did, of course. And do you want to show the third one? Oh, great. This one is only in Dutch, unfortunately, right?
It's my latest book.
The latest book on medical aroma care.
Yes. That is not available in Dutch, in English, unfortunately.
But there is one more coming, if I'm not mistaken. Tell us a little bit about it.
Yeah, I'm working on a book on aromatherapy and also other complementary techniques, I should say that, in pain management. And with this book, I will elaborate on the pain model of Lucer, which is an American pain specialist, and it actually involves the whole holistic care around people with pain. So that is in all levels. So the physical pain, emotional pain, spiritual pains, and everything to do with complementary integrative therapies for that. And that's going to be written in English, and so will be worldwide available. And for my clinical aroma care book, I feel that there was a bigger need in the Netherlands, and that in English, actually, we have quite a few good books already. And so I feel that as a specialist in care for the very frail, that a pain book would be more useful in the short term. So by the end of 2021, it should be ready and available. So if you don't know what to get someone for Christmas 2021, that's gonna be it.
You can already start shopping. So this is so wonderful. This is why I wanted to include different specialists from different areas. So for those of you, the rare few that still don't know what Madeleine does, she has lots of hands-on experience, right? As a nurse, and as a therapist.
I used to be a nurse back way back long ago. And I got frustrated with the fact that we were only talking about the diagnosis and not about the patient with the diagnosis. So that is since then become my main focus in my professional life, and that's intertwined with my private life anyway. that we should look in a holistic way to people. And in the hospital, I just couldn't find that really. And so I quit my job, and then I started to look into more other ways of caring for people. And so aromatherapy in the clinical setting was actually a way that could also be used by non-aromatherapists if you train them well. And so, but I had many years, I had my own practice, having the nurse in me, and it will never go away, the nurse in me. And I still keep up with my nursing skills in a more theoretical sense, I admit. And integrate my nursing skills with aromatherapy. Sorry, let me just get, I'll get rid of that later. So for me, it is so natural to let's say that pain. My book is going to be about pain, my next book. So if you look at pain, you can maybe take away the physical pain stimulus with an essential oil, or with maybe a foot soak or a massage. But there are so many situations where we may not be able to take that physical pain away. And then when we can make people feel more relaxed and safe in their environment, and I talked about that actually at Botanica this September, on the scent perception of people with dementia. And when you make people feel safer and more at home in their environment and in themselves when they suffer from dementia, which will cost them their ability to reason with their pain, to explain why this pain is there, then you may actually do something about their pain in a more indirect sense. But it has a direct consequences for their physical pain. So we can do so much with so little, but we need to look at the whole circle of a human being. And that is what I really missed in the hospital, and which is since then become my passion in life, is to alleviate symptoms and improve quality of life for the very ill.
Thank you so much. So for Madeleine, not only has her experience as a nurse and as a therapist, she also teaches for many, many years, writes articles and books. And just like you mentioned now, I was very surprised because some of this information that you share in your books and your education programs, I never heard anywhere else, especially this concept of pain. I read in quite a few of your articles that you mentioned that you had the patient inhale and then it physically, like you just said, released. Mm-hmm. That is such a precious information that you actually had the experience.
Yeah, it is. It is. But we also need to really look at safety, because I'm now writing a new, it's a Dutch training, it's a new year training for oncology nurses. Mm-hmm. And so I'm writing this especially for nurses and for nurse practitioners in the Netherlands who are going to learn how to incorporate aromatherapy in their clinical practice with cancer patients. But we know from research and also from experience that the airways, the mucociliary clearing in the airways, for example, is compromised by chemotherapy. So if you have a cancer patient, rather than this non-cancer patient with pain, then inhalation of a fragrance may be not so uncomplicated as we may think. So I'm all about safety. And so that is a very important thing. And these days, while aromatherapy almost tsunamis the world, I feel that it's so important. Yes, sorry. I don't do 50 Shades of Grey. I do black and white. So, yeah, you know. And so, but I feel even more passionate about this safety issue, because cancer patients these days, they take drops of essential oil under their tongue, and you know what I mean. And so we endanger them by just following all the advice on social media, which is very not much advice. Anyway, so to make a long story short, I feel that because I work with all these fragile patients, that is even more our responsibility to sometimes take a step back and lower the dose and see where we get with the ideal dose rather than with the high one.
Absolutely.
Okay, so you don't throw the kitchen sink all the time. I do sometimes, and if I need to, I did it with Case when he was in ICU. I threw the kitchen sink because he was dying of a pneumonia after his cardiac arrest, right? So, and I did that, and I had some, of course, my own experience, my clinical work and the research. I was backed up by a few very dear people in the aromatherapy field, like Mark Webb and Rhiannon Lewis, doing that. And I was very grateful for that. But that's not always a possibility. So when you work with dementia care, with palliative, with oncology, with children, and so there's so many safety issues, and that's why I feel that training is so important to do. So next year is actually a cancer care year at Kikozo, because I do this training. It's a whole year for nurses from the Netherlands. But in April, we have Rie coming and Carol Scheidel from the US, COVID permitted. Is she going to be there, and we'll do a cancer care masterclass at my location with my beautiful garden. So, and that's going to be in English, of course, from the 11th to the 20th of April. So I hope you're all going to be there.
Yes, of course. So this is a great opportunity, and get on the list now, because I think everybody's gonna be there.
Yes, and we only have 12 places.
Oh, okay.
Yeah, it's gonna be a real exclusive because we have all these teachers, of course, and it's gonna be a wonderful program. Anyway, so but that is my passion, and I write about it, and I teach about it, and and I love using your system to help me do that, really, honestly. Mm-hmm.
Thank you. So I have 3 things to mention about what you just said. So I just try to remember. So I try to remember. So first of all, this is with the referencing what you said and the social media and things. This is also one of the reasons why I ended up doing Dropsmith, because I wanted everything to be clear where the information comes from, and also a lot of times people like you, like authors, are quoted but not quoted, but just kind of taken your information, which I think is really disrespectful, because it took you a while to get to that knowledge. So I really want this to people to know where the information comes from, and that's why I'm doing the interviews as well. So they can. Great. Thing you mentioned was safety, which I also think it's really, really important, and the right dose. So what I noticed with some of your recipes in your fabulous books, they are recipes, people, so you need to read the book. You are not shy to go and use some intense oils like peppermint, for example. When I worked, and I had also the great opportunity to work with nursing homes and homes for the elderly, I was always afraid to use things like peppermint or eucalyptus.
Why?
I don't have the experience you do,
Better safe than sorry. It's better to avoid something you don't know well enough.
Exactly, and then I would suggest the book and to contact you directly for more information. But I was at the beginning surprised to see that you can go to that quantity if you know what you're doing, and that's what I think you're saying.
Exactly that.
Sometimes it's very effective to use a little bit and just inhale, and you're already working on pain. And sometimes you have to use that dose, or it doesn't work at all. If I'm
sure.
So that's, and the third I wanted to mention, not only your masterclass, which it will be fabulous, and we're gonna put the link below the video so everybody can go and check it out.
Right. Thank you.
Also, Madeleine now has also online classes, so you don't have to travel. You can get her wisdom online. Do you want to say anything about that?
Yeah, well, I was a bit forced by Mr. COVID or Mrs. COVID to get out of my comfort zone, because the only time you can get a computer to smell is when you burn it. And so I'm all for live education and fragrant oil, so you can have the full experience live, but it's not always possible. And also, the first time I got out of my comfort zone really was with a few webinars. And that was interesting because the webinar was for AIA in the US. And so I had to get up in the middle of the night at 3 o'clock in the morning to give the webinar. Yes, it was very interesting. So I did two, one on pain a few years ago, and only recently, I think I can't remember now, in April or so, or maybe a bit later, I'm sorry, I can't remember. It was on a very bad case of cold sore in a hospice patient, which I cleared up in no time at all, which was very interesting. And so I got to know a little bit more about the online thing. And then I was actually going to Japan this year in October, but then COVID got in the way and Japan is still closed for people from abroad. And so we decided to do the 3-day course, which I'm going to do in Japan again in the middle of the night, but then the other way around. We're going to do that online. So if you speak any Japanese or English, because I'm going to teach in English and it's going to be translated, interpreted actually simultaneously, you can still get online for that and get in touch with the organizer in Japan, which is interesting. So, and after Botanica, or actually during Botanica, which was so brilliantly organized by Rie and her team, that was amazing, and with Aldi and all of her people. So I already had some Dutch courses scheduled online, and now I also have scheduled some English spoken courses, so I'm doing them myself. Yay! And the nice thing about it, I feel anyway, is that you're gonna get that fragrant experience, because each and every one of those participants is gonna get this little package at home with the course material and the mini fragrant drops of essential oils. Speaking about drops, so they can experience the scent, and it's going to be entirely brand independent. So you can still get your own extracts and essential oils from your supplier, but at least you know what kind of fragrance I'm talking about. So you can think about one on dementia care and restlessness, one on dementia care and pain. There's one on November 28th for emotional well-being in palliative care. And next year, we're going to do some about wound and oral care. So this is, of course, all for the clinical setting, for the very frail patients in the hospital, the nursing home, but also for home care people and aromatherapists who are more involved with the clinical aromatherapy. And for the emotional well-being courses, you don't necessarily have to be in clinical aromatherapy. You can be an aromatherapist, and you know about relaxation and sleep. I will give some tips for that, and of course they will require some investment in time and a little bit of money, but in return you get a lot of experience and clinical and research work.
Absolutely. The information you share is always so unique. It's just.
Well, I try to reference it all, and I'm not saying that all the research is always of good quality, but I like having backup for what I do, and also as much experience as I can get it. Case studies, for instance, I published quite a few case studies, and also safety information. I mean, there's not only the books by Tisserand and other people that will give me safety information. So I always check the latest research to see if what we thought is still valid today. Yeah. So every time I write a new course, I will check the research and see if there is a change. Like in Clary Sage, we know that it has a dopamine action and that it may interact with haloperidol, which is a very well-known antipsychotic, which is used in elderly care quite a bit. And so then when you know it interacts, it may only be in mice, but it makes me more cautious
Yes.
about giving it to people in elderly care which are possibly on haloperidol. So I would advise against it until I'm really sure it's innocent.
Yeah,
So
there are
I
other
always try to outweigh the benefits against the possible risks and contraindications, and that's my second me. It's the way it is.
It's wonderful. Thank you so
Mm.
much. Okay, so what inspired you to write your books?
Sorry?
What inspired you to write your books?
I guess one of the persons that inspired me to write actually was my previous husband. He died of a cardiac arrest, actually, in 2011. It's almost his anniversary of his dying day. And just about 6 months before he died, we talked a lot about putting my knowledge and the teaching I did into a writing, into a book. And so I started it. And then when he died, that of course threw me off everything for quite a bit. And so about 6 months after that, I thought I need to move on. I need to do what we talked about, and I need to get it out there. And so I started my first book. I published my first book in Dutch on palliative care. So the book you have now in your hands, that was first published in Dutch. Yes. And it was sold out in no time at all. In about 18 months, it was sold out. So I published the English one after that, and a new Dutch edition after that. And so I think it's a wonderful way of sharing what I know, because not everybody can go to come to class or go to a course, and so many people already have quite a bit of knowledge, and they may want to just add on that with what I do. And the latest book, which I published in May in Dutch, I felt there was a good time for that, because as I said, there's this tsunami of essential oils flooding the world, and not always in a very safe way. And I felt for the Netherlands at least, but also for outside of the Netherlands, it's so important to get down to safety again, because there's so much going on. And I'm not saying that you should never ingest essential oils, or you should never do this, that, or the other, but there are so many safety requirements, and you should be knowing what you're doing. And so I hope that with my books I can contribute to that. And yeah, there's so many wonderful experiences that we have in all these clinical settings, that it needs to get out there.
Absolutely, that's why we included you. And you've been such a great support from my very beginnings, before it even came out.
We've go back a long time, actually.
Yes, yeah, we do. It's been quite nice to have all of your support. So do you want to share with my people here how you decided to support? Why you've been so wonderful?
Well, when I got to know you, I thought that the system you were going to make to help us formulating with essential oils in a good way and in a safe way, it was such a brilliant system which everybody could learn to use when they speak a little bit English anyway. And of course there are more languages, but you'll get there. I'm sure you do. So I felt this system would fill in the gap between those people that learn about aromatherapy or have become aromatherapist and their formulating work, because formulating is not easy. And I've been a herbalist also, apart from an aromatherapist. So I felt that in the world of plant medicine, there is this gap where you could actually look up what you've been doing and see if that's what you thought you were gonna end up with, if that is actually going to be the case. So what I like the most about it, because I'm very experienced in formulating, but what I like the most about it is if I blend for a certain type of complaint, but then so whether you're blending for a range of products available to everybody, or you're blending a product for an individual patient, there's a whole different world between that.
Yes.
So, but if you want to look up how much is left of your constituents in a certain blend, or if you want to make sure that a certain constituent or a functional group like phenols or alcohols are sufficiently present in that product, your program comes in brilliantly, because that is so easy to calculate, and then it backs you up.
Yes.
Or it supports you, and it's also referenced.
Yes.
Which I like very much. And so you can look that up. You can look up the studies. I'm all about study. I'm not 100% only about studies. It's a fine mix between studies, experience, individual patient care. So I feel that this fills in a gap for people to formulate and see if they're on the right track.
Yes.
And if they're not, to rethink it. And that your system makes that really easy.
Thank you. So do you use it in your practice or schools, or how do you?
In all fairness, I use it sometimes. In my school, we point people in your direction, and there's another system. We point them in those directions to make their own choices. The thing with my school particular is that we train nurses. If they come for a 1-year training, we train nurses to use aromatherapy safely in their nursing practice. So for them, this year is already filled with so much, only the basics, that they find it difficult to wrap their heads around another system while they're just starting out. But I have a colleague, and her name is Janet Nienhuis, and she has a school where she trains aromatherapists in the Netherlands. So many of my students move on to study with her as a nurse, and then they can skip their first year there, and then in another 2 years they become aromatherapist, and she offers actually your system in her school, and they can then move on to choose that system. So I feel that in the 15 days that people are here together in my year, that's a bit too much for them, but I will acquaint them with it, and they can make their own choices.
So you think that Dropsmith is for people who already have some knowledge, and then they can apply it?
Yeah, to be fair.
Yeah, I didn't make it
to know at least that there is some there are some things that are called constituents. Also, people that just getting to know essential oils, like when they don't have much training, but they how should I put it tactfully? I don't do tact very well. So let's say they are in the tsunami, and so they want to know more about essential oils. I highly recommend it to them, but I also recommend to go alongside with them to go to school.
Yeah, absolutely.
Get some course. Okay.
Yeah.
But also what I like is very much that cosmetical formulators, and there's so much more than aromatherapy that uses essential oils and CO2 extracts. You know.
We will add that.
That's right. So that they can use the system to see if the additions they want to put into their face wash or foot cream or whatever, that is a safe and effective, and that it's also, I love that so much, that is actually research based.
Yes. Yeah. And you're right. My idea was to fill in not only that gap, but many gaps, because I got to work with nurses, I got to work with massage therapists, I got to work with doctors of chemistry, and I also get to work with distillers and everything in between, you know. So I try, my mission is to try and put them all together in a safe way that's all referenced, not only as coming back to the author or coming back to the researcher, coming back to the distiller, so you know where the oil comes from. That's very important.
That's what I think is so great about it.
A lot of my students don't know how the plant looks like, and you should know what that plant is and which part of the plant is. Every information gives you, like you said, the holistic approach to using that oil. And although your formula might have 2 or 3 oils, it
Yeah.
takes you a while to understand why those 3 oils at that ratio.
Yeah.
So.
Yeah. Well, I've always been very pragmatic. I'm a very down-to-earth, pragmatic person. So although I have a hugely important spiritual side to me, not many people know that, but I do. So I believe so much in how the emotional, spiritual side of scent and scent communication and the fragrant message in a bottle of essential oils can work for you. But I always need I need some backup because I'm trying to make connections. I'm a bridge builder between the natural world, so to say, and the mainstream healthcare system, where I feel that we should reach out to grab each other's hand and go forward together, and also that we should acknowledge and respect each other's strengths and power, but also our limitations. So we cannot replace a kidney transplant with essential oils, although some people may say, you know, but we can't. And so we need to, in this case, we could help boost immunity, not against the own body, but against the viruses. We can help them in relaxation. We can help with procedure anxiety. We can help so many ways in the integration of care. And that's why the Kerkhof is the Knowledge Institute of Integrative Care. And that's what I have believed in all my life. I feel there's a road we should go together. And maybe we'll go a bit of that way and a bit of that way, but patient well-being is one road which we could all share if we respect each other.
Well, that's a wonderful note to finish on. I have nothing better to say.
Thank you.
So, thank you everybody for watching. I will put all the links below so you can get in contact with Madeleine directly and see exactly why we're using her books in Dropsmith, her very special view on essential oils. And Madeleine, you might think we don't notice your spiritual side, but most of our quotes for how to use it for the spirit are from you, just so you know.
Oh, thank you so much. Anyway, thank you, Melanie, for your kind invitation. And I'm so happy to have shown a bit of myself to you. And I'm a really convinced supporter of your work. And I think you're marvelous. Thank you very much.
Thank you so much. And bye.
Bye.